Hey guys, just a reminder, this is not official medical advice. For such, please seek an appointment with a licensed medical provider.
Hi, this is Dr. Tom Rogers coming to you with a weekly podcast of the Common Sense MD. Today's a special treat, something I've been talking about for a long time, actually 5 years. I have one of my favorite ever patients and people, Donna Lampkins.
It's good to be here, and I've been excited to share this with you.
We've been trying to do this for a while.
We have. We've been talking about it. We just never made a time to get it and get it going.
I always love to have patients on here occasionally because it's real life, and it's not right like the bragging that, you know, I'm such a great doctor or anything, but she is a great patient and a knowledgeable person. And so it's good for me to have patients on here in real life to show you what you can actually do as you get older. Now, Donna was on here with me 5 years ago when she turned 60. What'd you call it? You can be
Yes, I'm the staying sensational after 60.
Oh, staying sensational after 60. Well, now that you're 65, you have a new statement for it?
I'm still after 60. As soon as I turn 70, we're going to straighten
well, that's
that out.
me. So
yes.
I need to come up with a term for that because I had to sign up for Social Security yesterday, and you have just signed up for Medicare.
Yes.
Which I've been on for 5 years. Well, tell me how you feel about turning 65. That's a watershed age because of Medicare. A lot of people retire at 65. That's kind of the age where people just say, well, you know, that's it. I'm old. I'm going to just bide my time till I die. You don't take that attitude.
No, and I definitely don't want to even think about doing that. But I have to say, I probably actually, it felt like in my 50s, I felt better than probably in my 30s in some ways. For the most part, once I started, I got onto the hormones that made a huge difference. And I told you once, it was like all of a sudden you were asleep and you just woke up. But they have been amazing for me. And once you fix your insides, I noticed that everything I wanted to do from the outside changed. You wanted to lose some weight. You wanted to take care of your skin, your hair, and all the details. And I love doing the details. So, but someday I do hope that I can start doing my own podcast for women out there that want tips and ideas of how to stay sensational after 60.
Well, this will be a good kickoff for that.
I'll
announce your podcast. Sensational after 60
yes.
with Donna Lampkins.
It'd be fun.
This would kick it off. You should do it. A lot of people listen to these podcasts and really, you know, you're really an influencer because you live it. And certainly you look gorgeous.
Oh, well,
you're
thank you.
65 years old and look at you.
Oh, well, thank you.
For those that want to tune back 5 years ago, we're probably going to put a link onto our talk when you turn 60.
Yes.
So can you tell me at 65, in your 60s, now you're in your mid-60s, you feel as good as you did in your 50s?
You know, right up until COVID. And then that sort of triggered some RA. And now I think it's more now the medicine I have to take sometimes makes me feel tired and different. But if it wasn't for that, there's nothing else. As we were talking a few minutes ago, I'm still 5'9". I have not lost any height. I don't feel 65 at all.
You don't look it.
Thank you. But no, and I think when you feel good inside, you just want to do those things on the outside. And you, even in your mind, the growth, the whole thing, that it all plays in together.
People worry about their cognitive abilities, especially women, as they get around 60s and certainly. And we see a lot of dementia. We see dementia way more in women than men, way more. As a matter of fact, it's the only disease out of the top 10 killers that women die of more frequently than men is dementia, usually Alzheimer's. My mom had it. My grandmother had it. The males in my family have not had it, knock on wood. But it's very important, and it's very misunderstood how you prevent this. And in my mind, the number one thing you can do is exercise. And then hormone therapy. There's so much misunderstanding about hormone therapy. And really, there's a whole generation of women your age that were scared of hormones because they thought they caused breast cancer.
Yes.
Estrogen does not cause breast cancer. And certainly if you don't take estrogen along with progesterone, testosterone, women need more hormones than men. You're certainly putting yourself at a disadvantage. I mean, look at the new studies from age 65 to 85. Women that took, this is a huge study that just came out, women that took hormone therapy from age 65 to 85 compared to women that didn't had way less heart attacks, way less all-cause mortality, less cancer of all types, including breast cancer, less atrial fibrillation, less hip fractures, less osteoporosis, less dementia. I mean, from every angle. And it's sad because a lot of doctors, most doctors and patients just don't realize this.
I mean, I know for me personally, it has made a huge difference. And I don't even second guess, how easy this is. I mean, coming in and doing the pellets, you don't think about it anymore until it's time to do it again. And I do know that if I go a little longer than usual without having them replaced, you can feel the difference. It's like I got to get in there and get them done.
Yeah.
So
most women tell me that. I'll still say pellets is the best way to get hormone delivery, male or female. There's no
but
comparison.
it's just so easy. And you don't have to take all the different, the creams. This is just the easiest way possible. And it's not, I used to think that the cost would be crazy, but it's not at all.
No,
I mean, this is the least you can do for yourself.
Yeah, I agree.
And I think women sometimes forget you can do something for you sometimes.
I love the fact that you're going to have that podcast for women because really, I've been a doctor for 40 years, and you see patterns if you open your eyes. And the pattern that I've seen with women is they're usually healthy and lean and fit. They get in college, and then they get married, have children, gain 5 pounds this year, 5 pounds the next year. And by the time they're 50 years old, when their hormones are really dropping out, I mean, they're way overweight. They're usually depressed. They have achy knees. They have mental fogginess. And really the root cause of that problem is because they've taken care of everybody else and ignored themselves. Women are caretakers. They're really better people than men. I'll tell anybody that. There's no doubt in my mind about it. They're actually smarter, and in every way, they're just better than men.
I won't argue.
I'm being honest with you. That's an absolute truth.
But you're true. When you do have a child, that's all your focus is there. Maybe I had mine young, so maybe that, I started a little bit before. But you're right. When you have children, everything goes there, and you come last. But sometimes if you will just give yourself something, you'll be better parent, better mother,
That's
and
exactly
more energy.
Right. Back when I grew up, my mom, even though she had a master's degree, she didn't work because she stayed home with the kids. Back then, women got to stay home, or I won't say got to, because that's harder than going to work, in my opinion.
Yeah.
But women today not only have all those responsibilities of their family, they have to work as well.
Yeah,
I mean, it's incredible.
And your
Men
mind,
could never do that.
And your mind never stops because, from family to work, the household is a job. So, and even though, my son is grown and everything, I still, take care of the home and work and try to take care of me the best I can,
Well, you're succeeding. There's no
Well,
doubt about
thank
that. Now, you're in real estate. Tell me a little bit about yourself and what your passions are for. I know you're a fantastic real estate agent.
Well, thank you. Real estate, I am a little different. I use simplicity. I have I've been doing this a little over 20 years now, and to me, I'm very relational with my clients, and it took me years to realize that you can do things very simply and be successful. All I do is I do not overpromise and underdeliver. I am very up straight with you. And I think a lot of the clients that I've got to know so well, and one of them, say named the Quillans, actually told me one time, I said, they came to an open house, I'll never forget, and they met me there, and they called me later. They said, we've been thinking about selling for years, and we talked to agents all the time, and we just never could do it. And they said they got back to the car, and they turned to each other and said, she's the one, isn't she? And I said, why? They said, we just believed what you said. It was that simple.
You have a very trustworthy face. There's no
Oh,
doubt
well,
about
thank
that.
you. But that, and I had to think that I am not the best at social media, and I'm not high tech. I'm just
Me either.
me. And the simplicity worked. And I stopped beating myself up.
I love that. That's why I call this podcast the Common Sense MD. Common sense is uncommon. I tell people that all the time. And one thing about you, do you find this to be true? My dad told me it would happen to me. He said the older you get, the more honest you are and direct with people. There's no need beating around the bush.
You lose all filters.
Yeah, you kind of it's kind of freeing though, because you really don't care so much what somebody thinks about you.
Yes.
You know, sometimes with my medical practice, I do things outside the box, thank God. But medicine today is, doctors are just, they're so ingrained in the way they used to practice many years ago that they're very hesitant to change or accept new ideas. And that's not good, because patients need more. Doctors have turned into a factory line where they're following algorithms. And the art of the doctor-patient relationship has been lost in primary care. I mean, if you're a surgeon, fine, you take something out, fine. But when you're primary care, there's an art to it. And it takes more than 7 minutes per patient to really get to the bottom of anything, except maybe, prescribe their Lipitor, their blood pressure medicine, or then their antidepressant when they can't figure out why they feel so bad. Especially with these women that are in menopause or perimenopause, they get depressed. And most doctors just put them on an antidepressant, which actually don't work, and they make the situation worse in most cases. I used to do it. And I'm not saying all of them are bad, and sometimes they're needed. Sometimes I do prescribe them, but not nearly like I used to. You're just a great example. I do want to tell one thing about you, because that was your goal, I think, 5 years ago, to win Dancing with the Stars.
Yes,
and she did it.
That was something that I wanted to do from the first time I saw the show. It's an amazing show, and I went to support a friend of mine, Sherry Jesse, that was in the show. And as soon as I seen that show, I said, I want to do this. Well, 2 years later, I was doing it, and I was blessed enough to win. That was a God thing.
That's a hard thing to do.
And it was right at my 60th birthday.
That is incredible.
And it was great to know that, you were competing against a lot of younger, more fit people. And again, the simplicity of what I'd done. I just wanted it to come from the heart, and I wanted to, do a good job. And like I said, it was again the simplicity of making wanting to tell a story with what I'd done, and I do feel the music. That's something it's a lifetime thing. I enjoy music, and I can feel it. So
I think all of us, there's music in all of us.
Yes.
I love music. I play guitar. I don't sing, but I've seen you dance, and it's incredible. You are a great dancer. I wish I could dance like that. But
it was definitely a challenge. I've always loved to dance, but it was a freestyle, just dancing. Yeah. This is dancing with rules, and it was different.
It's very hard. I know my son Andy was in it, and I watched him go through the process, and he won it too.
Yes,
and he's
amazing.
Turned into a good dancer, and he's very artistic, can sing, he can do everything.
Yeah, he's like a super talent. He does it all.
It doesn't come from me, that's for sure. It comes from Jenny. But in any event, it is amazing to watch you dance. And you're right, music. Really, I tell people when they get in their 60s, that should be the best decade of your life. And I'm hoping 70s even better. But when you think about it, you've established your career. You've had your children, probably.
Yeah.
You're mature, and you're ready to do things that you really couldn't afford to do or have the guts to do or afraid to do. Now you can actually do them.
Yes, and step out, and the things you thought, well, I'm going to look silly if I do this. Now, like you said, as you get older, it's not as important as it was.
You just
when you
don't
were
care
yeah.
so much.
So it's like, okay, if it doesn't work, it doesn't work. But I've always had this passion because I come from a little coal mining town.
Tell me your story about how you grew up.
I grew up in Virginia, Dante, but we call it Dank because we're hillbillies. But grew up there. That area of Southwest Virginia, there is some amazing, hardworking people, but their mind is closed, and that is one thing, and mine was too. And so that was the one thing that I had to change, is to know that you could do something different. But it can be a depressing place, and I think like the song says, it's you either coal mining or on down the line. That's all there was. There was no other choices there.
Yeah.
But they didn't feel like they could leave that place. So I grew up there, got married very young. I got married actually at 15 years old.
Wow.
Yeah,
Wow.
I had my first child. I was almost 18.
Wow.
Well, my only child, actually. But I was married 42 years, and got, I guess, as I got older, I knew that wasn't right for me, and so I got the courage to end it. And scary, but I've made it okay.
Well, you have come out of your life just wonderfully. I mean,
thank
I love
you.
you to share that story with us.
And I love sharing it with people because I thought that was a story I hid for years, and that was crazy. It's like there's nothing to hide from.
You should be very proud.
Yeah, well, I am now, but then you weren't. You felt, I guess, almost in a sense ashamed because that of where you came from, uneducated, so people automatically going to think you're dumb, or I thought it was in here, but. So.
Certainly you're an amazing person. You're very smart. You're beautiful.
Well, thank you.
And you've come through a lot. And there's no shame in anything. Unless maybe you hide it.
Yeah,
and
that is the
to
shame.
hide it.
That is the shame, and I had to learn that. That took me. I guess I was in my early 40s before I actually started to, I guess, almost like a late bloomer, because I was like. It's kind of just held down and in place until that moment you thought, okay, it's now or never.
I'm so proud of you, and I'm so grateful that you're my patient, and that you're willing to step outside the box and tell your story. And it's all about just being a good person and helping other people out.
Yes, and that's why I wanted with this I wanted to share my story and how the hormones has helped me, because I have had such good advice and medical care from you in every way, and now I'm the methane blue, and I think I like that, the methylene blue.
Methylene blue is amazing. I just took my dose.
And as you said, I'm thinking, okay, you're getting that age and you're forgetful. That I thought, okay, you said how good that is, and I guess one of the best things. And you talk about simplicity. You told me one time, I'm not afraid to try something as long as it won't hurt you. And I thought that, okay, I like that.
Yeah.
You're not afraid to try.
No,
and so,
I'm afraid not to try.
Exactly. And most of them are going to go by the textbook. You got this, you take this. And like you said, you go in, you're there 5 minutes. Here's your blood work. This is good. You need any refills. Bye. See you.
Yeah. That's not the way to practice. It's just an impossible way to practice good medicine, because you really want to get to the root cause of the problem. If you're sick, find out why. A lot of times it comes from gut dysfunction, and a lot of times it comes from stress and anxiety. I did a podcast recently on anxiety, and the title of it I made anxiety. What are you worried about? Just try to think, why are you worried? And I have a lot of people who obsess on their every little bit, every little feeling they have, and they kind of drive themselves crazy with it. And
I may be in that group. I am
you're not in that group.
I'm an overthinker. overthink everything, and so that, like I said, a little bit of the anxiety. I have that. Nothing's ever exactly right, and I want it to be so perfect, and you're never going to get there.
You're never going to get perfect.
No,
I mean, we're all aging,
Yeah.
but you can certainly do it in a great way. But you're right. Stress and anxiety play a huge part. To me, they're toxins.
Yeah.
Just like sugar would be a toxin to most people. But,
Yes.
You can certainly, if you try to work out why you're so stressed, and a lot of times it takes professional help. I certainly, believe in that, therapy. But a lot of times too, the patient will bring it on themselves a little bit. I've had patients that have been to 50 doctors, including Mayo Clinic and
Wow.
all those places,
Yeah.
trying to find out what's wrong with them. They can't find anything. So sometimes they come to me, and sometimes I do find things that nobody's looked at, but other times I don't. And
Yeah.
I'm very honest with them. I'll say, I've known you for years. You've had all this workup, and you're obsessed about certain things you may feel, but the main thing that's wrong with you is that you think something's wrong with you. And sometimes you just have to be that honest.
Yeah.
And sometimes it's like talking to a brick wall. But, that 1 out of 10 kind of starts thinking about that statement. It actually helps them. So I try to guide them through that. If you're a family doctor, you're going to have to be a good psychiatrist as well.
And be honest enough with them to tell them, hey, you probably ain't going to like to hear this, but this is, if you've checked everything, and So, and a little bit same in real estate. Sometimes I have to tell them bad news, but I will do it.
Yeah.
It's just that's why I'm there, to be honest and tell the truth. So it may not be always what they want to hear.
You're helping people in a lot of ways. I mean, I think just helping people out and being kind, the two of the best things you can do for your own health. I really do.
Yes, and just to me, have that sincerity. Everybody's not going to like you, but like you said, as age comes, it's okay.
That's exactly right.
It's exactly okay. Very okay.
That's exactly right.
But the people in your life that matter, they know who you are, and that's all that matters.
They do. Sometimes I think you can almost count on one hand your true friends.
Yes, there's very few, and I'm good. Oh, yeah, and I'm okay with that. Yeah, it's about the quality and not the quantity, for sure.
That's right.
Yeah.
Today's world's, it's hard to live. It's a little more stressful
it is,
than it was when we grew up.
Yeah,
for sure.
Yeah, there's things in today's world that I never even thought about. Even a few years ago, stuff that didn't even bother me or I didn't get involved in, now it's like top of mind. Everything.
Yeah, but in the end, you shouldn't let it, like politics, you shouldn't let it bother you too much. What are you going to do?
No, exactly.
It either drive you crazy or you kind of accept it and
or
live
try
your
to
life.
just turn all the channels off and don't even listen
That's exactly
anymore.
right.
Yeah.
I do not like listening to this cable news all the time.
It just makes you angry.
It makes you bitter, angry, and sometimes the truth's kind of in between the two polarizations. But anyway, for health, I've always emphasized nutrition, exercise, sleep, handling stress, and then hormones. I mean, when you get our age, if you don't look at your hormones, you're really shortchanging yourself, and you've probably been fed a bunch of misinformation about hormones. Of course, we do not use synthetic hormones. I would use those over nothing, to be honest with you, but there's a better way to do it, bioidentical hormones, which you'll never hear about through your regular doctor because they're not taught that. They're not promoted by big pharma. You have to go to a compounding pharmacy to get them. But there's certainly a great advantage, and if you can do that along with the other stuff like you do, then you're going to look like this when you're 65.
Well, thank you. But it's a process, but it is about the details. And you talk about the hormones. That is the biggie. That was a game changer, and everything and every way I started to think and evolve, and just to become the best person that I can be. A continuous work, and it always will be, but that is the one thing. Start somewhere, and the hormones is a great game changer, and he does do the blood work. He just doesn't guess on everything. And
you need to do a detailed blood work like the Cleveland that we're going to do on you next week. Because it tells vitamin levels, cortisol levels, insulin resistance, stuff that most doctors never even consider checking. And a lot of times I will find a problem with a patient that they haven't even looked at that yet.
Yeah, and I remember years ago when you first started doing it, you actually done one. That was back when you were before you'd started performance medicine, I think.
Yeah.
And I remember it came in this big book, but I thought I need to do that again. But yeah.
Well, you were smart. It's paid off, hadn't it?
Yeah. Well, hey, yes, for the most part, I feel blessed. But, just I'm excited to hopefully, get to help other women with details of how I do what I do, whether, be from cosmetics to skincare and all the little things.
I love
yeah.
it. You're a blessing to me.
Thank you.
I want to thank you so much for coming on here. And really, this will be the opening of your own podcast.
Yes, that's what my hope is to start.
What are you going to call it?
Staying Sensational After 60.
Staying Sensational After 60. Well, you've done it, and you will continue to do it for many, many years, and you will help many women.
Good. That is my
and if you
hope.
help the women, you help the men.
That's right. Yes. Hey, win-win.
Well, Donna Lampkins, thank you so much. I look forward to you getting your podcast out and continuing to be your doctor and your friend. Thank you so much.
You too. Thank you so much. Appreciate you.
You're welcome. We'll see you guys next week.